Hi, my name is Timeka, also known as the Green Warrior Princess. I'm a mother of two sons, 26 and 21, and I've been a wife now for 26 years. And what you might not know about me is that I have kidney disease. I started having these symptoms approximately 25, 26 years ago. I was diagnosed with systemic lupus, and from that came some issues with my kidneys very early on. But at that time, fortunately, because the lupus was so new, the kidneys eventually reversed themselves and started working better for about 20 or so years, or 10 to 15 years. And then within the diagnosis of systemic lupus, I was diagnosed with lupus nephritis, which is the inflammation of the kidneys. And lupus nephritis eventually just totally ravages the kidneys, which puts me to where I am today, on dialysis because both my kidneys have been destroyed by lupus nephritis. So I am on dialysis, and that is what's, helping me stay healthy. And the prognosis of getting a kidney would definitely extend my life for a very long time, and I would be healthier. And I understand that in some cases, the lupus symptoms would be quiet, so to speak. I would no longer have high blood pressure and all the other health issues that come along with the lupus. So the prognosis is really good if I am able to get a kidney, but it would be great if I am able to get a kidney from a living donor. To stay alive, I have to do dialysis. I do dialysis 7 days a week, 8 hours a night. My dialysis is done at home, fortunately, and it's called peritoneal dialysis, and it's basically when you get dialysis through a catheter that's in your belly, that had to be surgically placed in your belly, and you hook up to a machine, and this machine puts in dialysis fluids in your body to do the work that your kidney cannot do. Um, I know I said I did it at home, but it has changed my quality of life. I have to seize the day during the daytime hours because the nights belong to dialysis. And my life kind of revolves around the dialysis and what time I got to be on and how long I have to be on. I just want to be free of that. I want to have my days and my nights free of dialysis. So, but it's keeping me alive. So I'm going to do what I have to do to stay around for my son, my husband, my friends, my family, and just kind of live longer. And right now, this is the best quality for my life at the moment. The best quality is I have my days free, but my nights belong to peritoneal dialysis. So I want to be free 24 hours, 24 hours free of dialysis, not having to do it every day of the week. So that would definitely make a big difference in my life, but it's keeping me alive, so I'm going to keep on doing it. I could get a kidney from a living donor. So far, I've been asking and speaking with friends and family. And most recently, I have launched a global search on social media, on Facebook, at the Green Warrior Princess, on Instagram, the Green Warrior _Princess, and on Twitter, the Green Warrior Princess. I feel like if I, widen my search, I will definitely get better results. And in lieu of speaking with people and social media, I also, when I'm talking to people, and they ask, "How you doing?" I no longer say I'm fine because I'm not fine. My response is, I'm doing okay considering I need a kidney, and I would prefer to have a living donor because you just never know where that miracle could occur. So my plan of action is to ask, share, share, share. And any opportunity that I get talk about it. You just never know who may be your miracle. I was surprised to learn that the wait list to receive a kidney is 7 to 10 years. 7 to 10 years for a kidney. That's a long time. Dialysis is hard on the body. That is why it is so important that when patients are on dialysis, they do try to get a kidney. I'm doing dialysis at home. It's a little less hard, but nonetheless, it's dialysis. And that is why it is so important, that I get a living donor. Now, the life expectancy with your new kidney is usually the life of the kidney. And of course, if you get a kidney from a deceased donor, the life expectancy of that kidney is shorter, maybe 10 to 12 years. But if you get a kidney from a living donor, I believe the life expectancy of that kidney could be 20 years and beyond. So that is why it's so important that patients like myself and others get a kidney, but getting a living donor is absolutely golden. And of course, the life expectancy without a working kidney, well, you know how that goes. You will probably not live very long. I mean, you can live doing the treatments, but just the dialysis again, it's almost like a temporary fix until you can get a permanent kidney. Without a living kidney transplant, it means for me being on dialysis for the rest of my life. The prognosis for me would be dialysis for the rest of my life until my life ends. And that is not the prognosis I want. The prognosis that I am hoping and praying for is receiving a kidney and living the rest of my life without having to do dialysis. With a living kidney transplant, my life would change for the absolute better. I would be able to do more things that I used to do in the past before my life revolved around dialysis. Right now, I have to do dialysis 7 days a week. 7 days a week. 8 hours a night. I feel like I'm losing precious time with my family, my friends, and just doing the things that I used to do. Also, with getting a living kidney transplant, it would enable me when I'm ready to travel, because I like to travel. Now, if I have to travel, I would have to take my medicines, which are large bags of fluid that goes into my system at night, my very big bulky machine, and then I would have to make sure I have enough medicine or get it delivered to wherever I'm going. It's just such a big inconvenience, and it just kind of puts a damper on things because I have to plan my entire life around my dialysis treatment. So if I get a living kidney transplant, I won't have to do that anymore. It would enable me to be free. I want to be free of dialysis, free of planning everything around, oh, I have to do dialysis. Oh, but I have to do dialysis. So yes, it would change for the absolute better. I'm making this video to share this information and to share my story, as well as finding a living donor. What I am trying to accomplish is to find a living donor by sharing my story, as well as sharing information to living donors and recipients to help people learn a little bit more about what is entailed with being a living donor, and maybe to help recipients and let them know what some options are for a kidney. Some may feel like they may not have known about a living donor. So the whole idea is to share, share, share. You be my voice. You be the voice for myself and other patients, and to educate and bring awareness to donating life and to kidney disease. Thank you for watching my story. Please share this on Facebook, Twitter, Instagram, and any other social media platform that you use, and help me find a generous person willing to donate. If someone is willing to donate a kidney, all you have to do is go to one of my social media platforms. On Facebook, it's at The Green Warrior Princess. On Instagram, it's The Green Warrior _Princess. And on Twitter, it's The Green Warrior Princess. Thank you.